Hello, everyone, and welcome to today's Tuesday topic. Today's topic is navigating microaggressions in the clinical space, a panel discussion for health professionals. While we are waiting for everyone's microphones to join in and for everyone to settle in, I thought I would encourage you all to visit our YouTube site, which a link for which you can find at the bottom of the page I'm about to paste into the chat. Give me just a second. If you go to that link at the bottom of that page, there's our YouTube channel, which has 114 videos currently that we have produced for the Tuesday topic series. And just a couple of recent highlights that we've done. Last week's session was Ethically Speaking, Creating Safe Research Environments. Before that, we had done Writing, Research, and Teaching Statements for Academic Jobs. And the match game using recruitment platforms to find research participants and biracial and multiracial experiences in an academic world, which was another one of the Tuesday topics brought to us by the Board of Diversity, Equity, and Inclusion. So without further ado, let me introduce you now to Hope Heffner. How do you pronounce the last bit?
Solimeo.
Solimeo. I'm sorry. I had it right before I started speaking, and then it just crumbled like a cookie out of my mouth. She is an alumni in the Art Therapy and Counseling program. And Hope, take it away.
Okay, great. Thank you so much, Darren. Thank you all. Welcome. I'm so excited to have you join this conversation with an incredible group of panelists. Again, my name is Hope. I use she, her pronouns. I am one of the adjunct faculty with the Creative Arts Therapy and Counseling program. I'm an art therapy alumni myself from the class of 2011, and really grateful to be representing the board of DEI within the College of Nursing and Health Professions. So a big shout out to Dr. Veronica Carey for helping us to put on this event today, and Amanda King and Darren. We're really excited for this conversation. I'm going to walk us through just a couple of group agreements and some context setting, and then we'll be doing our introductions of our wonderful panelists, and I'll be pushing it and kicking it over to them. So one of the first things we wanted to offer was that we're really hoping today to have our ability to explore the experience of microaggressions as healthcare providers, thinking through that experience as you maybe enter the field or you are in the field. And how are we navigating these things when they happen with a patient or a client, or perhaps with our colleague, and in all the directions that microaggressions can occur. We also wanted to make sure that we were discussing the ways in which we've navigated those, disrupting them, advocating around them, but also coping, the way we find community and stay in connection, and also advocate and navigate through systems with policies if we need to. We also wanted to ask that for all of us in the space today, we hope it'll be a robust conversation, not only amongst the panelists, but that you all as participants will give questions into the chat, your experiences, your validations to us. And so part of this is we wanted to ask that all of us are really mindful of being welcoming to each other, to all aspects of ourselves, whatever thoughts, feelings, and questions arise, that we'll ask them hopefully with the feeling of safety and authenticity with each other, that we'll approach each other with curiosity and respect, assuming good intent with each other, being questioning of our own maybe responses and what's coming up for us, particularly if discomfort arises. Can we be curious about what that maybe is telling us for ourselves in this moment? And then finally, we'll also use the model of intent versus impact, that I could say something, one of the panelists, each other, any of us could say something with good intention, and yet the impact could differ from that. And so we want to acknowledge and create space where if harm is caused, then to be able to talk that through together. Does that sound good? I'm seeing nodding heads from the wonderful panelists. I know, give me a shout out. Thumbs up, and yes, there's thumbs up in Zoom. Please feel free to utilize this reaction tool. Thank you so much. Okay, so one of the things we wanted to offer is that microaggressions is a large category, a phenomena that is sometimes harder to define, but we definitely can feel it in our gut when it happens. And so we wanted to offer that there are some ways for understanding microaggressions. One that maybe more of us might be familiar with, being that the act-based approach. This is coming from the work of Daryl Day, Wing Su, and Daniel Spannerman, really offering this idea of microaggressions are these acts that can be verbal, nonverbal, messaging in an environment that influences and conveys a negative or denigrating thought or invalidation to someone based upon an aspect of their identity. It's really, this model is focused on like saying, well, this could be a micro insult, or there's a micro invalidation, or a micro assault. And while we think there is absolute value in that understanding and taxonomy, we also wanted to offer an alternative taxonomy that reorients the focus from microaggressions being on the microaggressor and the action to the person receiving that microaggression and the harm caused. Because these things can be somewhat ambiguous, the harm can expand more than just the action and go into different permeable levels of our lived experience. And so we have the harm-based approach by Lauren Freeman and Heather Stewart that was more in a response to this original taxonomy. And so we wanted to quickly offer that there are 3 ways of experiencing harm in this alternative harm-based approach from understanding microaggressions. One is epistemic microaggression, so harm related to someone's capacity for knowing. An example that maybe could come up in a healthcare situation would be if a medical provider invalidates someone's own sense of their health knowledge. So denying that if someone's saying, I have this symptom, I have this concern, someone responding with, oh, well, don't worry about that. Or this is not a concern, actually. An emotional microaggression would be failing to take the emotional reactions or experience of someone seriously or ignoring them. And an example of this would be the way that harm can be caused when someone is being asked to, well, if you only said this nicer, then I would be willing to have this conversation, right? So the example of tone policing. And then finally, the third category is marginalization-based or identity-based microaggressions, which are ones that I think are more of like those examples we tend to think of off the top of our mind. An example that could be dead naming, or questioning someone's citizenship or where they were born, or stereotyping that is harmful and, again, causing a single narrative to be told about a person. Okay. So we wanted to offer this, the panelists, and we all discussed this as a way for us, again, to kind of give understanding and naming to this. But we know that these things aren't perfect categories. And so this is why we want to have nuanced discussion with this amazing panel. And it's my absolute honor and joy to introduce them to you all. So first up, we have Casey Boone, who is an art therapist and counselor who actually is an alumni of the program here at Drexel from the class of 2022. He is currently working towards his LPC and ATR-BC credentialing and works as an art therapist and counselor at Cooper University Hospital in Camden, New Jersey, Jefferson University Hospital in Philadelphia, parent-to-child private practice in Philadelphia, and also holds an adjunct faculty position at Penn State University College of Arts and Architecture in the Office of Digital Learning. He's also a member of the Art Therapy Advisory Committee at Drexel. And then prior to this, Casey offered therapeutic services for children, adolescents, and their families in a pediatric medical setting, an outpatient family care center, an intensive inpatient behavioral health hospital, and virtually through a public health program focusing on work with immigrant populations in the Philadelphia area during the COVID-19 pandemic. Casey works with a strengths-based, child, family-centered, and trauma-informed lens and employs narrative therapy, mindfulness, Adlerian, and solution-focused techniques. And he also has supported clients and their families through a varied array of unique and co-occurring challenges, such as depression, anxiety, self-harm, trauma, body image, grief, loss, neurodevelopmental needs, neurodegenerative diagnoses, medical changes, and others. Casey practices a queer identity affirming lens and has experience navigating this exploration with clients and their families, which is a particular clinical passion of his. Thank you, Casey, for joining this panel, and welcome. Okay. Next up, we have Sophia Collins. So Sophia Collins is currently at the Children's Hospital of Philadelphia. And sorry, I'm pulling up my and works as the program coordinator, community and advocacy nurse, and is also the executive officer of the Multicultural Professionals Network and Employee Resource Group at CHOP. Sophia is passionate about advancing social justice, diversity, equity, and inclusion efforts and community initiatives. Previously, Sophia served as a bedside nurse in the clinical space for 17 years and was also the clinical nurse program manager for CHOP's regional-wide school-based testing initiative, Project ACE-IT, aimed to reduce the risk of in-school COVID-19 transmission and bolster confidence that safe in-person learning is possible when testing is included in mitigation strategies. Sophia also coordinated the CHOP community-based vaccine clinics, which proposed to reduce the health disparity within Philadelphia by providing vaccine access to underserved populations and zip codes of low vaccine uptake. Currently, Sophia oversees the nursing pathway program at CHOP in partnership with the Boys Latin of Philadelphia High School and Middle School, a program designed to promote nursing as an obtainable career path for diverse students and ultimately increase enrollment of diverse students into nursing post-secondary programs. Sophia is also faculty at the University of Pennsylvania in the School of Nursing as a seminar lecturer. And in her spare time, Sophia enjoys spending time with her 3 children, running, reading, and is an active member of the Alpha Kappa Alpha sorority and Jack and Jill of America Incorporated. Thank you and welcome, Sophia. All right.
Thanks for having me.
Thank you for being here. Also representing CHOP is Nathalie Musey, and I'm pulling up Nathalie's intro right now. Sorry, I have multiple screens. Thank you all for your patience. All right. Nathalie is a physical therapist at CHOP and received her undergraduate degree in biology from Villanova University and her doctoral degree in physical therapy from Arcadia University. Nathalie underwent a pediatric residency program at Children's Hospital in 2018 and received a certification as a pediatric clinical specialist. Nathalie works with patients from the ages of 2 months to around 20 years old of age, treating a variety of diagnoses that include neuromuscular disease, developmental delay, and sport-related injuries. Nathalie is also a member of the Children's Hospital's Rehab Department, DEI Committee, serves as a mentor to minority high school and undergraduate students through 2 programs established by this committee, and also serves as a guest lecturer for Arcadia University's Doctor of Physical Therapy program. Not to mention, she's also the program director of the Health Career Summer Academy at Arcadia, a summer camp program designed for middle school students in Philadelphia. In her spare time, Nathalie enjoys volunteering with her religious community, reading, exercising, and taking care of her plants. We have several plant enthusiasts on this panel, actually. And finally, last but not least, we have Lana Sommers, who is here, also from the class of 2022, is an art therapist and counselor working as a middle school counselor at Friends School and in private practice at the Parent-to-Child Psychotherapy Associate. Lana attained their master's in art therapy and counseling from Drexel University, again, in the class of 2022. And Lana is a neurodivergent, queer, non-binary therapist and advocate working to change awareness and systemic change and upend the misconceptions of how to help neurodivergent people. Lana works within schools and with families to examine the ways that neurotypical standards in schools and in the broader social world create loops of self-doubt and shame in neurodivergent people. As a neurodivergent person, Lana has lived experience as well as clinical expertise in neurodivergent advocacy and support. Lana believes that the more we know and understand, the more we can listen to neurodivergent people, examine our own biases and reactions, and shift to center and celebrate neurodivergent brains. Lana is also involved in running the Gender and Sexuality Alliance for Everyone, G-Safe, at their school and running groups with parents to support them navigating parenting children with ADHD, anxiety, gender identity expression, and other challenges in today's world. In their spare time, Lana can be found with their 2 cats, Nemo and Lupine, doing CrossFit and spending a wild amount of time in her garden. All right. Thank you all so very much. And I'm really excited to open up the panel with this first question. What comes to mind for you, panelists, when you think of this phenomena of microaggressions and your own healthcare careers, your experiences? What comes up for you? Sophia, can I ask you to kick us off?
Sure. Hello, everyone. Thanks for having me and attending. When I think of microaggressions, as Hope mentioned, just being in a variety of clinical spaces over the past 18 years in total, 17 years at the bedside. Unfortunately for me, it has come with the territory of being in nursing, especially as one who identifies as an African American woman. I've been in clinical spaces for a number of years as the only Black nurse of color, and have had my share of microaggressions. And so for me, it's definitely come into just about every role that I've had over the last 18 years. And when I think about even the word microaggression, micro being extremely small, I feel as though the aggressions have been just the complete opposite of that. Thinking back to childhood, the nursery rhymes, sticks and stones may break your bones, but words will never hurt you, is, I think, farthest from the truth when we think about the words, when I think about the words that have been said to me over the years. And so I think there has been harm. I think that the harm through microaggressions are lasting. I think depending on the environment and the culture of the setting, it can really be a toxic work environment, and it can be a true detriment that can last, and unfortunately have people leave the field, which is really unfortunate.
Yeah.
Thanks, Sophia. Yeah, the power of community and the importance of finding it to manage that experience. That we said it in our intro for this panel, right? Like, it's not an if, it's a when this is going to happen. So, Lana, would you like to share as well?
Sure. Yeah, I think, one of the things that I also think about when it comes to microaggressions is like isolation. Microaggressions can feel very isolating. And I know a lot of people on this panel have experienced like being the only one of their identity in certain settings and kind of having certain things rest on your shoulders. And even being given responsibility based on your identity is part of this harm microaggression cycle. And so it can be veiled in, but you understand. It can be veiled in kind of this like, but you're competent, like you're the one that knows, which is in some ways, in a lot of ways, like very isolating and harmful, because you're given more work and things are placed on you just based on an identity that you didn't choose often. And so I think it's extremely isolating to not only have that weight, but also then to experience all of the microaggressions that come through alone, sometimes in your clinical setting. And it's why I think one of like the most healing and supportive things that we'll talk about later in this discussion is the community element. But like when you are very alone and someone makes a comment and everyone looks at you, like that's a different kind of isolation. So, yeah.
And piggybacking off of your comment, Lana, that like feeling of isolation when you're the only one, like in most offices that I've worked in, I'm the only Black female working. And sometimes when you are the only of a minority group, people will like not talk about it, right? They almost want to pretend like you are not a minority, you're just one of the many in the office. But a lot of times that feeling of like you're ignoring what makes me different actually makes me feel worse, because I don't feel accepted. I just feel kind of like put to the side and overlooked in a way. And that can influence like the conversations. So when we were preparing for this panel, I'll age myself a little and talk about like an experience I had in the office. Like growing up, I was a huge Spice Girls fan. And one time we were talking in the office about the Spice Girls, and, they were talking about like, oh, when I was younger, my friends, I would sometimes dress up as this Spice or that Spice. And in my mind, I'm like, well, when I was in school, and if I was usually the only Black girl in the school that I went to, or in my class or group of friends. And like, I didn't have a choice. I just had to be Scary Spice because I was the only Black girl in the group. And so when I was first starting out in these professional spaces, or like with my colleagues and feeling different, I would be uncomfortable when that conversation was happening around me, but I wouldn't want to acknowledge like my difference because I didn't want to make everyone else feel uncomfortable. But I've learned with time that sometimes I have to bring it up, and it's okay if other people are a little bit uncomfortable, because I was uncomfortable to begin with. So it's okay to like, sometimes you have to acknowledge the difference, and that takes time. It's not something I was able to do when I was a student or a new graduate. But now I feel like I don't want to feel isolated, and I want to acknowledge my difference because I'm proud of it.
Mm-hmm. Yeah.
Happy to jump in if that's okay.
Mm-hmm.
Yeah, I not to reference TikTok, but heard this really like wonderful quote on TikTok the other day that was talking about pride. And how pride generally, not just like the queer community, is, and the importance coming from like what it means to live, if only a portion of your life, and authentically for a certain amount of time, and what that means when you kind of move forward or own a new identity, or one that you've had that's more visible, and how different sort of microaggressions sort of eat at that, and any progress you feel like you've made. I often, to kind of like put it in a tenable compartment for myself, think about these types of things from like a psychoeducational component, often working with groups of adults that are in like a healing setting. But, that assumption that if this is something we're talking about or we're doing, that we want to grow and we want to learn, or develop a deeper understanding of some of these things, and try to just put it in a like a cognitive behavioral lens of just kind of like, if these are automatic thought processes that are the maybe unconscious result of, engaging in some overgeneralization, how does it continue to exist in us as a reflection of our society? And, what do each one of these little cuts sort of mean as we wield them at each other or receive them? And I think interprofessionally too, in the medical setting, it's really tough, because there are always these little small, what feels like small power grabs that are either intentional or not, but seem to come from a place of feeling separated and self-defensive, and, result in people acting either intentionally or not a bit outside of what might be appropriate or fair or reasonable.
Sure.
Oh, sorry, Lana, go ahead.
No.
My name is Denise, and I'm on the diversity, equity, and inclusion. I just wanted to say, sorry I'm a little late, but you're talking about microaggressive behaviors. And I was listening to what Nathalie said and Sophia was saying, especially, young, 18 years old, which is really sad to listen to. And the day, this is 2024, and you still have to experience it, these type of behaviors, which I think is sad, because I'm a little older, and today I still experience some of these type of behaviors. So to listen to, this the different conversation here, it's just such an eye opener. And you say to yourself, why do this still exist today? And it's unfortunately, going to continue. As believers, a lot of education to be learned. And each individual should be proud of who they are and don't have to hide. I always think about, I don't know if you remember this song, I forget what group, The Whole World's like a masquerade. You kind of like hide behind, this mask here, and we shouldn't have to do that. I would encourage each and everybody, just be who you are. And, this is 2024. And for those who don't understand, you have to educate them as to what's happening. Yeah, and I would just say this to be for real. I'm sure you remember Angela Davis back in the day, right? And I was more like a type like Angela Davis, but I've grown over the years. You really have to have a conversation and make sure that everybody understands there's a place in the world for everybody. And I would just say, just be who you are and let people know I'm here to stay. We don't have to be aggressive. But again, these comments, you don't have to just ignore them. As Dr. Kira always say something about them. When people, have these negative comments, sometimes you have to think and sometimes I have to think. But I will say something about it. It's not aggressive, but I will comment on it, to get the respect. Because when you don't comment on it, people think it's okay. And again, I would just say it's a lot of education. And from my years of experience, as I said, I still experience, and I have to tell people, excuse me, no, that's not who I am. No, I'm here as an assistant professor. You constantly have to validate yourself, and you shouldn't have to, but you should say something about it because people will think, oh, that's the norm, and it's not. So that's what I just wanted to say.
Thank you, Dr. Way. Appreciate you. Alana, did you want to respond?
Yeah, I feel like this is something that we also, can talk about is what do you do in those situations? Because, I really appreciate what Casey said about how a lot of times these, there feels like there's power and there's like this, like grab for power, and microaggressions are within that space. And the thing that, I think we also want to consider is, yes, how do we deal with it in the moment? But how do we deal with it personally too? Because that has an effect on people over time. And over time, we have more and more studies about the impact of, oppression on people's mental health and on their like chronic stress and on the levels of cortisol in their body and what that does to their health. And so it is, it takes a lot of energy, it takes a lot of time, but it also takes a lot of active, like trying to reverse those effects, trying to connect with others, because microaggressions are separating and they're like harmful in that they pull people apart. And so I think, challenging them, how do we as the panelists here, how have we challenged them? And also like, what is hard about that challenging process?
Mm-hmm. I think go ahead, Sophia.
No, I just wanted to say that I definitely agree. And I think for purposes of this conversation, just talking about the microaggressions in clinical spaces, I think it's important to call out. I know for nurses, it's a stressful job. Like we love what we do. We love to care for others. But we also do, to your point, we have to care for ourselves. And so as I was preparing, I read that nurses are at an 18% increased rate of suicide. And, through COVID, right after COVID, it was deemed the year of the great resignation for nurses. And so we already at baseline have to deal with a level of stress and burnout just because of the nature of the work, understaffed, undersupplied, all the things. And then on top of that, we have to deal with these grievous comments and these toxic work environments just due to a lot of different things, but lack of mutual respect, right, for our individuality and how we show up and come to the table. And it matters, like the environment, it matters how we handle each other, it matters. And all of this adds to the level of stress and burnout. And it ultimately affects the care that we give to others. And so it affects our outcomes, our clinical outcomes for our patients, as well as the impact that it has on ourselves. So it definitely it is a problem and worth conversating.
Yeah. And in clinical spaces, you have, especially when you're a new graduate, right? Like you're a student, so you have mentors, you have preceptors, and then you're trying to make sure you're doing the right thing clinically. When you work in pediatrics, you have the parent, you have the patient, you have the family. There's like a lot of dynamics that at times in the moment, it can feel very difficult to manage all the things you're feeling and address the microaggression while at the same time giving the best quality care to the patient. I didn't know, Hope, did you want me to give my experience?
Or if you would like to speak to that, Nathalie, please. Yeah.
We had talked about environmental microaggressions, like when there's something in the environment, the setting you are in, that causes an impact on your psychological well-being and your psychological safety. And when I was a student, I was actually a resident at CHOP. I walked into a patient room and there were Confederate flags everywhere, like a poster kind of on the wall. The patient had a bandana on his head and he was putting stickers on his water bottle and on his notebook. And for me, that's an immediate trigger to turn around. And if I'm in the car, I'm turning around. If I'm walking, I'm going the other way. But if I'm walking into a patient room and my preceptor, this was the first time I was going into this patient's room by myself, right? So I'm trying to prove that I know how to address the patient's needs, and at the same time fighting with this feeling of wanting to leave. And I can be honest and say in the moment, I didn't know how to handle that emotion. So I just kind of stuffed it down, got through the patient care encounter because it ended up being okay because the patient has an oncology diagnosis. The oncology team came to give the parents bad news. So the parent had to step out of the room. And the patient was very upset and was why are they talking out there? What's happening? And my presence was distracting for the patient. So whereas the mom, when I had first walked into the room, kind of looked at me in a what are you going to do kind of way? Because the patient didn't know what that symbol meant, but the mom did. So she looked at me how are you going to react? In the end of the encounter, she was so grateful that I was there to distract her child while she was dealing with this bad news. So in the moment, I blocked it out because I didn't know how else to address it. And I think it's important for students and new professionals to understand that there will be times where you might not know exactly what to do in the moment. But with time, you'll learn. It is important it took me some time to talk about that encounter and talk about what that meant and understand how that impacted me and how that made me feel in the moment. So there's just to show an example of how there's a lot of dynamics in health professional spaces that can make it difficult.
Thank you for sharing that, Nathalie. I mean, it makes me think about how when I am faced with a situation where somebody has microaggressed once or continuously, how it often seems to be in the interprofessional space in a treatment team meeting or things that aren't necessarily patient facing, and how it's interesting where, the patient that's being microaggressed is not present in the space, but, like what it means to have them still be there and have these things existing between other professionals, and knowing how it's biasing the care that they're providing. And, I find, oh, go ahead, Lana.
No, I said, I'm like, oh, I didn't think about the amount of times that does happen all the time in those kind of backdoor kind of meetings. Yeah.
Yeah. I mean, when we think about the isolation or being the only one present in the room that, holds a similar identity or is, of the mindset of wanting to engage or correct or offer education, it can be very interesting. And I've, said things in the moment. I have, talked to the staff member individually. I find most often when people use like antiquated language, specifically recently, we on the pediatrics unit here, we see a lot of patients that live with sickle cell disease. And we know that has a really high prevalence with African-American / Black population, the population. And yeah, just not saying antiquated language and offering education as to why we don't use that language anymore. As and a hope to build bridges. And then to also just know, as like a new professional in the field, that this person that I'm offering education to has maybe gone through a few cycles of trying to update like their clinical lexicon, and operating with the understanding that the stigma sort of follows, and trying to promote a sense of like ongoing awareness with that. But systems level of power and care, and where is our voice the most impactful? And I think it can be very challenging to navigate.
And I think there's like the interprofessional space of these things where you are someone who's looked at to advocate, and I also think it gets really from my experience, it can get really it can activate some stuff in me when I hear these things, or when someone talks about one of my autistic students in a really incorrect way, or when people have like all of these biases about neurodivergent people based on like when they grew up and, misinformation and everything. I get upset. And so there's something too about like, I hold the same identity as those people, many of them. And part of that comes with a lot of like emotional dysregulation. And so it activates similar things in me that I then find it quite challenging to have any kind of discussion in the moment, because it's so dysregulating and so upsetting. And I think something that I find both challenging and useful is the fact that I work with kids. And that makes some of the dynamics, what Nathalie talked about is like the kid had no idea what that symbol meant. Parents did, right? And I work with a lot of LGBTQ plus students, and I have trans students whose parents are not affirming, whose parents are horrible in the way that they talk about all of these things. They're people that are, don't know and are trying to, and are not in a learning space. And as a professional, I understand that. But as a person who holds those identities, I don't feel safe with those people. And so advocating when you don't feel safe is extremely difficult to do. It's essential and difficult, which I find very challenging. And so what I like about working with kids is I'm advocating for someone who I am their advocate. And so it puts me in a different place of like, yes, I share your identity, and like, you don't have another advocate, right? It is me. And so I feel like it boils it down to be like, in some ways allows me to speak up and kind of pull out a different part of myself. In another way, it neglects a part of myself that's going to need care later. And so I do feel a lot of this, like I have to push and pull things forward for myself in those processes. So I have a trans student whose mother hates me because I have tried to have discussions about the needs of her child, and she does not like me. And she has called me a groomer, which is something that many queer and trans people get called when they work with children who also hold those identities. It's this idea that we're indoctrinating young people. And I remember that experience, my student telling me about this, a conversation that he had with his mother. And I remember in my body feeling nothing. And I remember feeling like, okay, just like, okay, because in the moment, my student was in front of me, probably wondering, like, what is Lana going to think? You know, what is this going to rupture something? Does this mean that they won't help me anymore? And all of those fears coming from my student, what my student needed at that time was for me to say, okay, I know that's not true, right? Like, and so later on, I had to do a lot of behind the scenes work to help myself. And I think that's something a lot of us are talking about is there's times when it's safe. And I didn't reach out to that parent, by the way. I was like, nope, not my job, not something I'm going to do, because I've already attempted to make some of those movements with that person and it's not working. So that is, you know, that is for other professionals to do at some point when that person is ready, because no amount of education is going to get through to someone who's not ready. That's what they teach you as a therapist, is like, you can't make people change. So people have to be able to listen to you. And kids will. And so that's where I find a lot of my hope and a lot of my like comfort in some of these things, is that when a kid does a microaggression, very often I can be like, absolutely not. And I can just correct them. They'll be like, oh yeah, sorry. Like, and they'll move forward. When an adult does it, there's a lot of defensiveness that comes with years and years of, you know, experiences. And so that is not just going to be a one and done learning experience. And so to sign up for that, which many of us are signed up based on our identities, the world signs us up for that advocacy. There's other stuff we have to do to support ourselves and to make sure that, okay, if we were signed up, are we ready to participate today or not? Like, are we gonna find other ways to like duck out and find other spaces where we feel safer? Or is this the time that, you know, are we resourced enough for this? Mm-hmm. I think that's something we can kind of talk more about too, is like, how do we do that? I know how I do it, but it is tough.
Thank you so much, everyone. There's so much richness to this conversation. And I just want to pull out that there's this balance that I'm hearing that everyone is having to manage, right? The balance of our personal responses and then our professional mandates and our professional callings to be advocates, to, you know, hold the professional line, to have the center be on and the focus be still on the patient or the client in front of us, right? And needing to approach with compassion, you know, I always think back to the unconditional positive regard, right? But there's also the need for accountability, right? That this internalized process of bias and how that informs behavior is a recapitulation of what people have taken in society. And it's coming up in our sessions, right? Physical therapy, nursing at bedside, a therapeutic session, but it's coming up and we're having to manage it in that moment. I'm mindful of time. And so I wanted to pull and ask for some of you to speak to just the ways in which we do tend to self. Because Lana, you offered that. You know, what are some of the ways that you tend to self, that you find community? And to ask if anyone's willing to start, kick that off.
I can answer that. I think it's critical, like I said previously, that we care for ourselves first, because we can't pour out of an empty cup. And so, Lana, to the point that you were making as you were talking, I was just thinking about the importance of allyship, right? Because it shouldn't be up to always just the marginalized person to have to stand up to egregious acts. I don't have to identify in other areas to be an advocate. And I think that it's important for us, for those who are willing, for those of us who feel comfortable. It wasn't always comfortable to have these conversations, right? But because I said of the long history, you become more, I'll say brave, right? You have to be brave to have these courageous types of conversations. And the education has also played a part in it. How do we stand up? How do we navigate these conversations? I think that that's all very important. And in this line of work, I've become more, I'll say confident in these areas. But it's happened over time. So I think that we have to be gracious to ourselves. I think that it's important that we're intentional about taking care of ourselves first. So for me, what does that look like? When I've had to go into war, I'll call them war zones, when I knew I was going into certain situations, right? That were hurtful, that were toxic, I had to make sure my cup was filled. So whether that was prayer, whether that was a word that I was meditating on, like different things that I had to do personally, where I felt like I was covered and before I went into these conversations, and that was just for me. I also, in the space that I am now, leading a multicultural professional network, which is an employee resource group. So we offer safe spaces for conversations, and when things happen, whether it be internal or external, it's a place where we can come together and have different programming and events. So that we find support and also our network and our community and find strength in that. And I think that's very important. And although I'm with this one ERG, again, I'm a part of several ERGs, whether I identify or not, because again, it's an opportunity to learn, to educate, and also to advocate. So I think that finding those spaces within your place of work is important.
I agree. Finding places like where, even if in your own office, let's say, you don't necessarily have people you feel safe talking to, those employee resource groups, different committees can be a huge help, because sometimes you just need to be able to talk through the situation that happened. Like, you maybe are not able to process what happened in the moment, or maybe don't love the way that you responded to the microaggression in the moment, but being able to talk with someone and talk through the experience you had can be really healing. And then it can help you learn how to then maybe address the situation if it happens again. So that's been really helpful for me, is just talking and not putting pressure on myself to like deal with it by myself, but to go and find help.
I mirror those things in a lot of ways. I mean, something that I do and have encouraged other people to do is I think a lot about the idea of stewardship. I mean, in therapy, we talk about trauma stewardship, where you're kind of just for a short time, like holding somebody's hand theoretically and walking with them for a little while, but that you have to also let go at a certain point. And with these types of things, and an advocate role, and, being personally microaggressed, when I get called a slur walking through the park by somebody who I perceive to be experiencing houselessness, I pick that up and I think through, like, what was the intention? What was the power sort of play here? And why did it happen? And I can pick up the sort of societal implications and the broader systems at play, and hold that for a little while and then let it go. And it's, to me, been a very valuable way of, engaging in things very intentionally, but also letting them go when they need to just be moved on, letting go of the need to try to change my coworker who can't use my patient's pronouns correctly, and just kind of engaging in certain interpersonal and personal systems in that way too. But I don't know, that sounded kind of clunky, but hopefully it sort of came across.
Makes a lot of sense to me.
Yeah, or speaking to the boundary that, I think Lana, you spoke to, but it's there's so much within us that will, because we're naturally joining professions that we're caregivers, right? We want to nurture, we want to support people. And so I think we have that ability as advocates to say, hey, and use some language like, what did you mean by that? Or, you know what, I used to say this too, but actually I learned that's really not the right thing to say anymore, right? Like offering that reflection. And then as things get to a point, or you're in situations like the one you just offered, Casey, where it's like, this is not the moment, right? We're always assessing risk in these situations. And so our ability to draw a boundary and then also say, I have to let this go, or this is not the moment, or this is not the parent who's ready to hear me yet, right? Like that navigation. And I want to offer, I can't help but wear my HR hat a little bit because I work in HR at CHOP, but it's also to say there's policy, right? Like Drexel has policy in the Office of Institutional Equity, and I'm messing up the name of it right now. Institutional Equity and Inclusive Culture, right? You turn to the structures that you sometimes need when things have to escalate, right? When it goes beyond a microaggression and becomes a pattern of discriminatory behavior, right? So there's opportunities there. I think we have time for closing thoughts. Panelists, I don't know if you'd like to speak to anything, and if there's questions from other members of this wonderful discussion, please feel free to share.
I just like to say one thing. Sorry. Again, listening, I think being in nursing for years, and then listening to your comments and your thoughts, it is tough. It's very challenging. And as new nurses, I would say, and Sophia, it takes a lot, and it's going to be very challenging. But one of the things I think which have really helped me is the different coping mechanisms that that will help you, the positive coping mechanisms, because you're going to be faced with challenges. And I always say this until to the day I die, I'm going to be faced with many challenges still to come. But I think what I survived is this, one of the things Sophia said, just a lot of prayer and making sure when I go on the job, I have to set an example, which I have as a professional nurse. I would always say, what would students think of if I was to go off and say these negative thoughts? That's not a positive role model. And sometimes that happens. And many years in my experience, it was different things that I had to endure. But one of the things that kept me going is I would say, you know what? I really love nursing, and I really want to take care of patients, and I really want to be an advocate for them. So when negative thoughts and negative things would come my way, I take a moment and I present as best I could, the image that nursing profession holds, because I take it it's very dear to my heart. You're going to continue to have challenging days, but you have to find a way. How do you cope with these different issues? I think the one great thing what I see is there's a lot of resources is available now, which I think is great. The students you mentioned it. Utilize it, because when I started nursing school, it was not. I've seen nurses, be intimidated. They quit. They didn't pursue the career as nursing because it wasn't a lot of resources. It wasn't a lot of conversation. So again, I just want to commend each one of you for sharing your thoughts and knowing that there's help out there. And I think it's great. But again, don't give up on your dreams and your goals. It takes a lot to persevere. So I would just say, continue to persevere and find ways which you can use positive coping mechanisms.
Thank you, Dr. White. Yeah, I agree. And I also think like it's about perseverance with others. It's not just about, I think it can be, I find it very hard because of the things that I find challenging in systems, because of the way my brain works, that like straight up just like shoving through does not work for me. And I need to have other people around me that understand how I function, so that when things do happen, I have people to say that to. And so it's why I have focused a lot of my practice with like clients who are also neurodivergent, right? And that for me is a very healing experience to both support them and help them navigate all the same kinds of things. And then also for me to be able to speak in a way that they understand and they understand me. And so I think there's like highlighting the parts of your work that feed that person that no one else really could understand, that person who shared something with you that they wouldn't share with someone else, right? Those are like the high points of clinical practice, when it's the joy of that. And then also like, we cannot do it alone. I feel very, very strongly that we cannot, and that why so many people leave the helping professions is because they feel alone, and because they don't feel like the systems support them or the people support them. And so I think all of us on this panel have found places, and maybe that's one of the reasons that we are still in the work that we are, is that we have found places that we feel heard and that we feel purposeful, and where we feel like we can make a difference based on the experiences that we have had to go through. And there's so much joy in that. Mm-hmm. There's like, I want to leave people with hope. I want to leave people with realism that this exists and that it takes time to navigate. But it also takes like a lot of perseverance and, continuing on. And you need other people. You need other clinicians that understand you. So the more we can have conversations like this, where one thing leads to another, and it's like, yes, right? Those are things that are deeply impactful for me and supportive for me.
Thank you, Lana. Closing thoughts, Sophia?
Yeah, I would just end with encouragement that this is, I know we've all heard that this is a marathon and not a sprint. I think that we've come a very long way in this work. I know I would not be here on this screen 50 years ago, 20 years ago, maybe. And I'm just, committed to this work. I think that when I speak, I'm not just speaking from my own experience, because I've met several other clinicians that look just like me that aren't comfortable, and that's okay. I think those of us who are willing to be that voice need to do it, but we all can be champions of this work. I think that, again, it's not just about our own lived experience, but also thinking of others, advocating for others, being allies for others is important as well. And just, continuing. So when we do have a seat at the table to make our voices known, I think we didn't really get into policy, but knowing our policy, we don't have to be in environments where we're feeling like we're beating down every single day. There are supports. I know within CHOP, there's supportive lines. There's an Office of Diversity, Equity, Inclusion, things through our HR. And so we don't have to endure this abuse, and we're not alone. And so I just think that we should really speak out and be that help and support to each other, especially those of us who are willing to speak up.
Thank you, Sophia. We have 1 minute remaining. I just want to check in, Casey or Natalie, is there anything you'd like to offer and follow up? No pressure, if not.
I mean, one thing that came to mind to me to share was, we talk about coping and like getting through these moments, but coping is different than healing. And like being able to do both of those things is really important and valuable and takes time to learn how to do. And I think those two things just kind of get conflated sometimes, but I think it's, being able to, like, the word endurance kept coming up, and I see endurance as it can be a strength, it can be a great coping mechanism, but it also, the wall has to come down a little bit, and we have to externalize and reconsolidate and, engage in community, like some of the panelists were saying. So that's my last little bit.
Rest is resistance too, right? And I am blanking on the speaker who said that. That's not my own thoughts. I want to make sure I'm giving credit where credit's due. But there were so many different points made today around this ability for us to tend to the personal self while also remaining committed to our professional calling. And so again, I want to thank all of you panelists for your sharing, for the gift of your time and your expertise. In closing, we had wanted to offer just a quick opportunity for people to see some statements, because we want to leave people who are watching this to know that there are things you can language to turn to. And sometimes it's nice to have language that's meaningful and present and quickly available. So quickly, we wanted to just share this and offer this as an opportunity for you to see other statements that you can use to disrupt microaggressions, and to know that we are here, and we in and of ourselves, this discussion today can be thought of as a community as well. So I'll put a PDF of this in the chat for everyone, but I wanted to thank everyone again for coming. Again, big thanks to Dr. Carey, Amanda, and Darren for helping us to put this on, and appreciate everyone who spent time with us today. Thank you all. Be well.
Thank you.
Thank you.
Thanks everyone for joining us for today's Tuesday topic. We'll see you next time later this summer.